Gasping for air after just a flight of stairs, breathing like you've run a marathon? Or does a simple walk to the grocery store feel like an Olympic challenge for your lungs? You know that feeling, don't you? And immediately, a worrying question pops into your head. Is this just tiredness? Or is my heart sending out a distress signal? Or could it be my lungs crying out for help? Today, we're going to put on our detective hats and dive into this complex case. We'll learn to distinguish between cardiac, heart-related, and pulmonary, lung-related, shortness of breath, focusing on the very first, simplest signs. I promise that by the end of this video, you'll have a much clearer understanding of your body signals, and you might even uncover a cause you never suspected. So, let's start with the fundamentals. What exactly is shortness of breath? In plain language, it's not a disease itself, but rather a symptom. It's that alarming sensation of not getting enough air. For some reason, your body needs oxygen, but it's not receiving it in the proper amount, and your body responds by sounding an alarm, forcing you to breathe faster and deeper. Our mission is to understand where the glitch in this oxygen delivery system is occurring. So our prime suspect in this case is the heart. Let's think of it as a pump, a powerful and tireless one. Its job is to circulate blood throughout the entire body. But what happens when this pump starts to falter, losing its strength? Blood begins to back up, especially in the vessels leading from the lungs to the heart. This creates a sort of bottleneck. Because of this increased pressure, the fluid part of the blood begins to seep directly into the lung tissue. Your lungs essentially become waterlogged, and you find it hard to breathe. And this is where the first clues emerge. A telltale sign of heart problems is swelling, or edema, particularly in the legs, which often worsens by evening. Why there, specifically? A weakened heart struggles to pump blood upwards against gravity. Fluid accumulates in the lowest points, your ankles and feet. A classic indicator is deep indentations left by sock elastic that don't disappear quickly. This is our first significant lead. Our second clue is closely linked to the first. If you find it difficult to breathe when lying flat and instinctively prop yourself up with a second or even third pillow to sleep almost sitting upright, that's a very concerning red flag. In a horizontal position, the congestion in your lungs intensifies, making breathing even harder. This is a highly characteristic symptom of cardiac shortness of breath. Another crucial symptom to pay attention to is chest pain or discomfort. Pay close attention to how you feel while walking. Does shortness of breath come accompanied by a feeling of heaviness, tightness, or a burning sensation right behind your breastbone? It's important to understand that this isn't always the sharp, dramatic pain often portrayed in movies. Many people describe it as a heavy weight on their chest, or like their chest is being squeezed by a tight band. If this discomfort specifically arises during physical activity and then eases or completely vanishes as soon as you stop and rest, that's a very strong indicator it might be heart-related. Next, pay attention to your heart's rhythm. Does your shortness of breath come with any strange sensations in your chest? For example, does it feel like your heart suddenly skipped a beat, then pounded hard? Or does it begin to flutter like a butterfly in your chest? Or perhaps it just starts racing, beating too fast and hard, completely out of proportion to your activity level. These kinds of heart rhythm disturbances, which doctors call arrhythmias, are another significant clue. When shortness of breath and these rhythm issues occur together, it very strongly suggests the problem is likely with your heart itself. And here's another piece of evidence, something you can literally see with your own eyes. Go to a mirror or simply look at your hands after any exertion that leaves you short of breath. Do you notice a faint bluish or even purplish tint to your lips? Or maybe your fingernails have taken on a purple hue. This isn't just a trick of the light or a sign of cold hands. This symptom, which medical professionals call cyanosis, is a very significant piece of evidence in our discussion. Let's understand why this happens. Oxygen-rich blood is a bright, vibrant red colour, but blood that has already delivered its oxygen to your tissues becomes darker, almost blue. When your heart struggles, acting like a weak pump, It can't effectively pump blood through your lungs to get recharged with oxygen. As a result, more of this depleted, darker blood begins to circulate throughout your body, and the first places to show this are areas with thin skin and a high concentration of capillaries, your lips, fingertips, and earlobes. Therefore, if shortness of breath goes hand in hand with such a colour change, it's a very serious indicator that your cardiovascular system is struggling to do its job. Now let's shift our focus to suspect number 2, the lungs. They operate with a completely different signature and distinct methods. If the heart is a pump, the lungs are a sophisticated system of filters and airways. And when issues originate here, the clues we find will be quite different. The hallmark symptom, almost invariably accompanying shortness of breath that stems from the lungs, is a cough. Listen to your body. Does your breathlessness come hand in hand with an urge to cough? This cough can vary significantly. Sometimes it's dry, persistent, and irritating, feeling as if there's a constant tickle or obstruction in your throat. Other times it's wet and productive, bringing up phlegm. This cough is no coincidence. It's your body's urgent attempt to clear its airways. Perhaps they're narrowed due to inflammation, as seen in bronchitis, or clogged with thick, viscous mucus. Your body reflexively tries to expel the obstruction with a forceful cough. So, if your shortness of breath comes accompanied by a persistent, nagging cough, especially one that intensifies along with your breathlessness, it's a very strong indication that the root of the problem lies within your respiratory system. Another telltale sound that can indicate lung problems is wheezing. Listen closely to your breathing, especially when you exhale. Do you hear more than just the normal whoosh of air? Is there a distinct whistling or high-pitched squeaking sound? This is a crucial clue. Imagine letting air out of a balloon by stretching its neck. It produces a thin, whistling sound. Much the same thing happens in your airways. This wheezing indicates that your bronchi, the tubes that carry air into your lungs, are constricted. Air struggles to get through these narrowed passages, creating that distinctive sound. This constriction can be caused by a spasm, as seen in asthma, or by chronic inflammation and mucus buildup, as in chronic obstructive pulmonary disease, often abbreviated as COPD. So, if your shortness of breath is accompanied by this sound, it's a strong indicator that the cause lies within your respiratory system. It's a hallmark sign. Now here's another crucial difference that helps us distinguish between our two suspects. Remember how we mentioned that with cardiac shortness of breath, you often feel better sitting up, and lying down makes you want to pile up extra pillows? Well, with lung-related issues, the situation is frequently different. Unlike cardiac breathlessness, pulmonary shortness of breath isn't as heavily influenced by your body position. You might find it equally difficult to breathe whether you're sitting or lying down. Why is that? Because the problem isn't fluid buildup that shifts with gravity. Instead, the issue lies within the airways themselves or the lung tissue. If your bronchial tubes are narrowed or inflamed, they'll remain that way even when you lie down. Yes, in some cases, lying flat might make it slightly worse due to pressure from other organs on the diaphragm, but you won't experience the dramatic difference seen with heart failure. You won't need to sleep upright in a chair just to breathe comfortably. Therefore, if you don't notice a clear connection between your body position and the intensity of your shortness of breath, that's another strong indicator pointing towards a pulmonary cause. Now let's take a look at the personal history of our suspects. Very often, lung problems are a story that unfolds over many years. Think about your lifestyle. If you smoke or have smoked in the past, this is the most obvious and significant risk factor. Tobacco smoke is a genuine poison for your bronchi and lung tissue, causing chronic inflammation and gradually destroying them. Or perhaps your work involves occupational hazards. Are you a construction worker constantly inhaling cement dust? Or do you work in a mine, a chemical plant, or agriculture where the air is full of fine particles? Inhaling such substances year after year inevitably takes its toll. Your lungs try to defend themselves, producing more mucus and becoming inflamed. This accumulated damage, this anamnesis, as doctors call it, is very serious evidence. If your history includes such factors, the likelihood that your shortness of breath has a pulmonary origin increases dramatically. This isn't just a hypothesis, it's almost a certainty. Another crucial aspect of our investigation revolves around time. When exactly did your shortness of breath begin? Let's consider two distinct scenarios. Scenario 1. Just yesterday, you could calmly climb a flight of stairs, but this morning, suddenly, even after one short flight, you're gasping for air as if you've run a marathon. The shortness of breath appeared abruptly, like a bolt from the blue. This is an extremely concerning sign. Such an acute onset often points to a sudden, potentially life-threatening event. For example, a blood clot travelling to the lungs, a condition known as pulmonary embolism, or a spontaneous pneumothorax, where air suddenly leaks into the space around the lung. Sudden and severe shortness of breath is a red flag symptom, demanding immediate medical attention. Now, consider scenario 2. You've noticed your shortness of breath gradually worsening over months or even years. Initially, you might have found it a little harder to walk uphill. Then, you started needing to pause when climbing stairs. And now, even a casual stroll causes discomfort. This slow, progressive decline more likely indicates a chronic condition. Your body has been compensating for the issue for a long time, but its reserves are slowly depleting. This pattern is typical of chronic heart failure or chronic lung diseases like COPD. Analysing the timeline and progression of your symptoms is a crucial part of our investigation, helping us narrow down the list of suspects. But what if the evidence doesn't quite add up? What if you're breathless but there's no swelling, no cough? Our investigation would be far too simple if we only had two culprits to consider. In truth, there are other villains at play, cleverly mimicking heart and lung conditions. And the first, a very common one, is anemia. Let's go back to our oxygen delivery analogy. The lungs are the warehouse where oxygen is loaded. The heart is the truck that distributes it. But what carries the oxygen inside the truck? That's hemoglobin, a special protein found in our red blood cells, or erythrocytes. Imagine you have an excellent warehouse and a powerful truck, but instead of 100 movers, there are only 10 working. That's exactly what happens in anemia. There's not enough hemoglobin in the blood. There's plenty of oxygen in the lungs. The heart pumps blood perfectly. But there's simply no one to transport that oxygen to your muscles and organs. As a result, your brain receives an SOS, oxygen deprivation, signal and commands you to breathe faster and deeper in a futile attempt to correct the situation. You feel breathless, even though both your heart and lungs might be perfectly fine. This is a classic example of why it's crucial to look at the entire system. Now let's meet another masterful deceiver, a clever trickster that often confounds even seasoned professionals. This is our own nervous system at work, specifically anxiety and panic attacks. Imagine this scenario. You've just experienced intense stress or a sudden fright. What happens in your body? The fight or flight response kicks in instantly. Your heart starts pounding, muscles tense up, and your breathing becomes rapid and shallow. This is an ancient mechanism designed to prepare your body for immediate danger. But in cases of anxiety disorders, this system malfunctions. It activates without any real threat present. During a panic attack, a person breathes so rapidly that it leads to a paradoxical effect. Too much carbon dioxide gets flushed from the bloodstream, causing dizziness, tingling in the hands and feet, and most crucially, an agonizing sensation of not being able to breathe. The person feels like they're suffocating and tries to take even deeper breaths, but this only exacerbates the situation. Outwardly, this can appear like a severe medical emergency, yet upon examination, both the heart and lungs are found to be perfectly healthy. It's a shortness of breath that originates in the mind, yet feels absolutely, terrifyingly real. But here's where our investigation takes an intriguing turn. Are you ready? People often jump to conclusions, narrowing down the cause of shortness of breath to either their heart or lungs. But very often the true culprit lies elsewhere. It's that third suspect we've mentioned. Conditions like anemia or thyroid problems can perfectly mask themselves as heart failure. And simply being out of shape can make you feel as breathless as someone with asthma. Why is this knowledge so vital? Because in the fear of a potential heart attack, someone might overlook low hemoglobin, a condition that's far simpler to address. Or, conversely, they might dismiss it all as just poor fitness, ignoring the early warning signs of a serious lung condition. Shortness of breath isn't a simple either-or situation. It's a signal from an entire system, and a malfunction could have occurred at any point, even the most unexpected. So, what's the main takeaway? Shortness of breath when walking is like the warning light on your car's dashboard. It doesn't tell you exactly what's broken, the engine or the brakes. It just screams, "Warning! Something's wrong. Time for a checkup." Your task isn't to ignore that signal, but to seek professional help as soon as possible to find and address the true cause. Thank you for watching this video until the end. I hope you found our little investigation helpful. If you did, please hit the like button and subscribe to the channel so you don't miss our future helpful insights. Now, a question for you. Have you ever experienced shortness of breath? What turned out to be the cause? If you don't mind sharing, please share your experience in the comments below. It could be incredibly valuable and helpful for other viewers. Stay healthy.